it wasn't like that at the beginning. It's been stirred up.
Mm-hmm.
It's all the crud that's been trapped here, and now he's abusing this as a result. But that's the... You see how much higher this is here? How much tighter? From here to here is huge knot. This is much lower. Let this side go. There it is. Yeah. That bone has not moved in a while. When my butt comes off the chair, I'm working way too hard.
That's so good.
Split there, babe.
I have my whole right side is messed up. Starting from my SI joint on the right side. When I play soccer, every time I shoot the ball, like I kick the ball, I'll feel like a pain, like right in here.
Okay. Yeah. Okay.
It's been going on for more than 2 years. I've seen
Okay.
everything.
Okay.
PRP shots, nerve blocks,
Uh-huh.
chiropractors, physical therapy.
Okay.
Done it all.
What are they saying is the cause of that pain?
They don't know.
Okay.
Nobody has been able to tell me
Alright.
anything pretty much. MRI doesn't show anything.
Correct.
Um,
Well, keep going. Yeah.
The last doctor that I seen, he told me that I have arthritis.
Okay, we're getting closer.
But the images didn't say that.
Uh-huh.
I mean, the report, I guess. And also, my neck hurts.
Okay.
Whole right side. I have a slap tear, my shoulder.
Okay.
And I have tennis elbow
Okay.
over here.
Are you feeling any pain in your shoulder joint right now? Any pain right there?
Yeah, so now after I was getting this therapy with these chiropractors, so now I kind of feel like something like here, like under, like
Okay.
my trap gets tight all the time.
Okay. Nobody said rotator cuff. Nobody's.
They do say rotator cuff, but
we'll check it all.
I don't know.
But you're pointing to more of the AC joint there on the front.
Yeah, I feel
Uh-huh.
when I go like kind of like that,
Uh-huh.
I do feel it like here.
The joint
Kinda
between
like
the-
here, yeah.
There's a joint between the clavicle and your scapula called the AC joint, and that's what
Yeah.
you're jamming when you work on it. A lot of what I do is try to open up the front. Our lives are so filled with, you understand, being forward, and that's what keeps all that area kind of under stress. I can fix the elbow. That's just it. These are attachment pains. So is it around that spot there?
Most of the tightness is like here.
So just the muscle. How about, this is okay
Yeah.
Not too bad?
I feel it like here.
on the medial.
Yeah. If you can see, my right forearm is bigger than my left one.
But
too.
that doesn't.
That one hurts.
Sore, okay.
Yeah.
So medial epicondylitis, and then we'll work on the muscles. The muscle tension keeps a constant pull on the attachments. The attachments have to be worked on. They won't self-resolve. We have to compress those down, and that's not too hard to fix. We'll work on that in a second. Is it both arms or just mainly the right arm?
Just right side.
Okay.
Whole right side. But most of my concern is my
Yeah.
back right here. Sometimes he goes a little bit to the side.
Yeah, you're pointing to the L5 facet. It's the joint. The joint capsule is what gives you all that pain. It's the actual knuckle where the vertebrae connect together. It's this last guy here, where the sacrum connects to the fifth lumbar vertebrae. This joint will give you pain in this region. This whole area will give you pain around the joint, but it's the joint capsule. Now, our imaging technology is not 4K. We're still living in a VHS world. You understand? We don't have this HD imaging, and so you're exactly right. The image doesn't show anything, but that doesn't mean there's not something there. We just don't have the technology to see it. We can see large injuries. Kind of astounding to me that they took an MRI at the end of 21, and then in like 4 or 5 months later they took a CAT scan. It's like we're going backwards. They took the best image, do you understand, in December, and that wasn't enough, so then they decided to take a CAT scan, which completely bewilders me. It actually shows less. It's actually wrong compared to the MRI, showed more, and then your CAT scan, which is a worse image, you understand?
Yeah.
Actually was wrong because the MRI would take a precedence over. You understand? If the MRI shows something and the CAT scan shows something different, you take the MRI.
I think he wanted to see the CAT scan because he thought I had, what did he say? I don't remember. something about when you're, he even took like blood work. I don't know what
Okay.
he wanted to see, but
Well, I'm just saying the report, the only thing they're talking about in the report differs from the MRI, and I looked at the CAT scan, and you don't see, to me, what they're saying you can see on the, not that it matters anyway, I'm just telling you that it's kind of redundant, you understand, to go
Mhm.
backwards.
Yeah.
We went and took the MRI, which actually can show you the discs. I'll show you the picture of what we can see. But more simply, it's the joint. You're inflaming the joint. This disc at L5 is also injured. You're 30 and this disc looks 55. You understand? Part of
Yeah.
your spine is older than you are. Every other disc looks about 18. You have a very young rest of your spine, and one disc is probably 55, 60 years old. Now, because this disc is aged at a faster rate, it also means that the joint has aged at a faster rate. They're both connected. You understand? So if we're wearing out the disc, we're also wearing out the joint. To fix you, it's pretty simple. We got to get the middle back moving better. This must be immobilized to allow you to be overstressing your lower back. So we got to get your middle back working. And then there's a curve that your back is supposed to have called a lordosis, and the loss of this curve, like a ladder, all the weight gets transferred right to the bottom, right? So the alignment of your spine determines where all the stresses go. And so the loss of curve continually puts stress on this area, and then the stiffness of your middle back ensures that when you're bending or when you're playing soccer and you're trying to kick something, all the movement's happening here, right? All the torque is being harnessed in one location, and your whole spine isn't working as a team. This is a side shot of so if I'm looking at your spine, it's like I'm looking at it from the side.
okay.
And these are the discs. The discs are water.
So whatever, when it's white is good, right? Yeah.
White is good, yeah. Look
So
how,
that one is, yeah.
See, that's about-
super short.
right, that's your problem. These discs do not regenerate, and it's starting to actually dry out. See that little dark spot? I mean, this is the best picture. This is the best imaging quality technology we have, and this is the best we can see. But see how it's getting darker there? That's called desiccation. The disc nucleus is starting to dry up. And over time, like a piece of bacon, it gets thinner and thinner and darker and darker. It's going to lose its white core. These are little stress injuries you can kind of see. These little white spots here on the bone, that little white line right there.
Mhm.
These are compression. You've had compression injuries where the vertebrae, they got, let's say busted a little bit. And there's actually still some remnant fluid, inflammation, let's call it, you understand, still in the bone, which tells me that you've been hard on your back. You understand, these are like stress fractures or compression. Eventually this could actually cause a compression fracture where the whole vertebrae collapses. That makes sense? And it's just showing you that you've been hard on your spine. Do you feel any symptoms down your legs, down your right
No.
leg? Okay, that's good, but
The first time that I felt this on the SI joint, my hamstring got really tight, but then it went away.
you hit this nerve, and then this nerve tasered the muscles. Now, it retracted a little bit, the nerve calmed down, the muscle contraction stopped. But if we don't get a hold of this becomes the more expensive problem. Why everybody has back surgery by 50. Tiger Woods in his 40s had 6 surgeries, you understand, because of disc injury, like I'm showing you on the MRI. That L5 disc is what is 75% of back surgery encompasses that disc. And our world isn't guiding us on how to prevent it, which I'm going to talk about today. We're going to help you. We got to get this middle back moving and get the curve back in your spine so that not all the stress is happening in one spot. The other discs in your spine, the other discs look brand new. You understand? These have not aged since you were 18. They're not working. They're not being chewed on like teeth that that aren't being chewed on. We don't wear out the enamel on the parts that don't work. The football players that spend their whole season on the bench don't get concussion. Right? The vertebrae that don't work don't get injured. Most of the stress is happening at that one disc. The joint is back here. We can't see. It's all blurry. You understand? But the joint would be back in here. You understand? And so that's what you're feeling. You can't feel the disc. You can feel these wires. That'll be down the leg, right? And the joint will give you that local pain, kind of around. It hurts here, Ed. That's the joint. There has to be an opposite stiff area to make this area be abused, right? And everybody's so focused on the injured area. I ask the opposite question. I ask, why are all the other vertebrae not injured? Instead of asking the question, why is that injured at L5, I ask, why are these not injured? And if you can answer that, you can understand why that area is injured. So the left side is going to be tighter, it's going to be more elevated, and because of that, the work is being thrown to the right side. So now when you're playing, I'm exaggerating, now when you're playing soccer, this side's under more stress all the time anyway.
Yeah.
Make sense? And that's why it's injured. It's like this part of your back is being used at 60%, the left side's being used at 40%. So every activity you do is already putting more stress on the right. The question I have is, what's so bad on the left side that you're avoiding it? This is where usually injuries when we're young, teenage years, childhood injuries, that, let's say things that you've forgotten have happened on the left that now have thrown the work over to the right. The left side doesn't hurt anymore because it's being avoided. No, it's my right shoulder head, it's my right lower back, this is the problem. And I go, no, the problem's over here in why are you not utilizing the left as much as you're using the right. Cross your arms. Bend both the knees. There we go. Take a deep breath in. Little sit up. Head back. Let it go. Exhale. Deep breath in. I got you, buddy. Head back. Exhale. Let it all go. Deep breath in. I got you. Exhale.
Yeah, that was different.
A little different, huh?
I never heard that many, like small like ups, you know.
Get the idea, right? This is restricted, and you're abusing this, and nobody's getting up here and loosening that area properly.
They tried, but not like. I didn't hear these small like pops.
Right. If you scoot down on your side face and exhale. So nobody, and my point is on the side, nobody puts their hand here. Nobody should be adjusting your lower back. This is where all the sore injury comes from. Doesn't benefit. We're just trying to loosen the guy below and above a little bit. Exhale. Yeah, it's too loose. Let's go on your back. Let's go on your back for it. There, on your back. You shouldn't even be side postured. You're so stiff in your middle back and in your hips that when I twist you, all the bending was trying to happen right at the injured area. Have they done that adjustment on your side
They've
before?
done that adjustment like all the time.
I think it's a bad adjustment for you. Because you're so loose, when you were twisting, all the twisting was happening there. I had no mobility. Now, it is a good adjustment to loosen the SI joint, but if this joint is so stiff, when I'm trying to rotate you, all the bending was happening here, then you're just further tearing. Does that make sense? The area that's already moving too much. This is tight up here, this was tight down here, and then all the bending was happening, all the folding was happening at the bottom. Is it right? Yeah. Watch. When I tilt my head to the left, the bones stick out on the right. This is part of why I was seeing, do you see how this is why you're leaning to the right?
Yep.
Can you see that now? See, I'm exaggerating, but you're going to grind this because your head is tilted left. In order to not walk around dizzy, your body's dropped. Your right shoulder, left shoulder came up. Now we're in left avoidance, right abuse. So it can actually start, it actually can solely be an injury to the right side of your neck that creates a head tilt, that creates a domino effect down to your lower back. Easy, easy. Just for reference, notice when I adjust you, I'm not going to adjust you, but my point is my hand was up here at the top, right? My hand was up here right off the occiput. No chiropractor should have their hand in your lower neck. You understand? Pushing into the lower neck. The lower neck and your shoulder are the same thing. The nerves that control and nourish and heal your shoulder come from the lower neck. So when the lower neck is upset, the shoulder will atrophy, become weaker, or any injuries in the shoulder won't heal properly. So they're both connected in the sense neurologically. We want to not put stress on people's lower necks. Chin up a little bit. There you go. Your head doesn't like to come over to the right. Lifting your shoulder and tilting your head are the same things. So tilting your head left and lifting your left shoulder are biomechanically the same thing. So when you lay on your left side your left shoulder elevates. And that's the same as tilting your head left, which feeds this. It feeds this misalignment.
Oh, you say, you know, once you get to my trap or my upper back, I have this weird, like, twitch.
Okay.
You'll notice it.
Okay. Yeah, this is not a minor misalignment here. Wow. Oh, come on. Oh. Yeah, we gotta. Wow. So there's a neck deneral that we'll show you in a minute. It's designed as a retainer and a stretching device that you can use at home, and its purpose is to emulate my thumb and allow you to stretch and mold the neck into the correct position at home at the end of the day. If your neck is not loosened up, then the function and benefit of the stretch is limited. So it's meant to be used in concert with being adjusted. You want to loosen the spine and then mold it on the stretch. You know, the curve, lordosis. Have you heard the word lordosis before?
No.
Okay. All right. Well, then nobody's really getting to the root cause, because the lordosis, the loss of curve in your neck and lumbar. We always hear of lumbar supports, cervical supports. What are we supporting? The lordosis. It can only be ultimately fixed through stretching. The adjustment and the massage is a tool to make it limber so that stretching can fix it. So just massaging it or even just adjusting it in and of itself will not work. It will never go away. This has to be partly done by you not laying on your left side, not feeding it, and then also undoing it through some good stretching. The stretching won't work if your neck is a 2x4, if your neck is all stiff. So we have to make the spine supple so that the stretching actually undoes it. Wait, let me see if I can. Relax this left side. Wow. I don't think anybody's moved like that before.
Yeah, well,
You
you can only get like one crack out of it, what, not two?
Yeah. There we go. Now the knots. See how the knots feels a lot smaller?
Yeah.
I know. There's a whole level of pain that you. I shouldn't have said anything.
I don't go that far.
So the attachment has to be meshed. You have to try to compress this guy. It's I know it's hard to self-compress. This is where, but you want to hold pressure from the forearm up into the elbow. So it's coming kind of from this direction up onto the epicondyle here, and you have to compress that down. It won't self-resolve. This has to be worked on for it to get better. I wouldn't do any transfriction over this, no massaging over this spot. This is just compression,
Just like that? Like what you're
straight
doing?
compression, no rubbing.
Okay.
I don't want to tear this off. You're just trying to compress the layers of the tendon back onto the bone, like Panera bread and paniniing and mashing. Right, you ever panini? You're doing a panini press. Do you understand?
Oh, Canadian president.
You're trying to press the bone back onto itself.
Oh, so because it feels like you're pressing the bone. I
Correct.
was gonna say like
The tendon dives into the bone, and we're trying to compress the tendon back onto the bone, like a tent peg. Right? If you have a tent peg, you want to drive the tent peg into the direction that it's being lifted out of, right? Which is this direction. We don't want to rub the tent peg. Then we're just going to rip up the ground and rip up the tent peg, right? We're just trying to press the tent peg
No.
back into the ground so that it has a good root. The muscle tension here will keep a constant pull on the rope, the tendon that attaches onto that attachment, the epicondyle of the bone. So if you want to rub anything, you would rub the muscle here towards the elbow.
Okay.
So you can rub the muscle belly here, and here, you can rub that towards the muscle. sorry, towards the attachment. I wouldn't do any gua sha on the attachment.
Okay.
Just here, towards the elbow.
What is it?
So when I look at your back, the left side is more elevated. This is where you're in left avoidance, right abuse. The problem is actually right here. This is why I get paid the big bucks. Because I'm going to show you where to work on, and when you're at home, it's right here. This is the problem. On your left middle, the right's just compensating. The right's just the effect of having this jammed up right here. I know, I feel it, Ed. Why? I'm sorry, but I'm sorry. Nobody showed you this, I guess, I'm sure, right? No. Nobody showed you that. Yeah. It's very obvious. Right there. This is why on your lumbar MRI, you have young vertebrae up here. They don't work. I'm putting my elbow on them and I'm asking them to bend, and they don't function. Mechanically, this part of your back is frozen, and then you're leaving all the function to happen at the bottom. If this area liked to function, it wouldn't mind me touching it, right?
Yeah.
If these joints were accustomed to bending, they wouldn't be screaming at you right now. They're frozen, they've been frozen, and the unlocking of these areas and then teaching you how to keep these areas unlocked is your care. That knot right there is something else, but okay. I can imagine everybody's been focusing down here, right?
Yeah.
Everybody's been trying to do something to his lower back, and they've missed that the rest of his spine doesn't work. Right here, totally jammed up. And so the lower back is just responding to being told to do all the work. Right there, yeah. Okay, take a break. Take a break. Right there. Oh, come on. Relax your shoulders. I know it's tough. Right there. This is where we're going to be focusing on our stretch later. We're going to put a piece of foam, and the apex of it will be right here. That will be your goal in the next month, is to be able to hold pressure here and it not be the end of the world. Rub the right side. There's a little knot here. I'm not saying it's perfect, but it's half the size of the left. This side actually functions. And there's some here, but it's not as big as the left. See, the abused side doesn't mind me moving it. It already moves, right?
Yeah.
The side that's abused and already injured from too much motion isn't upset too much when I ask it to move because it's already been moving. It's only the restricted side that really hates me to ask it to move. It's been frozen, and that is the problem. I mean, there's some, but you can't. I'm not gonna. I can make you scream on this side.
Oh, yeah, you can.
No, thank you. This side, I'm sure it doesn't feel great, but the left is worse. There's some right there. There's definitely some restriction here It's about half the size of the left. Yeah. That's on the left side. That's on the left. You feel all that, right? I mean, this is all. Whew, whew. Yeah, injury right here. Probably when you were a teenager, yeah, maybe younger. It's like, you feel that? Whew. I don't know if I've ever felt like something like that. That big a difference just from. You feel the difference, right? Smooth.
Oh, yeah.
See? Smooth.
And then the other side?
Look at all that.
Oh, yeah.
Look at that thing. How could they miss this? How could you miss this? Terrible. See? It's totally smooth. That's remarkable, the difference, and you actually can feel, this just came out from my elbow, but
Is it more fluidy than it was?
no, it's hard. It's like an old hard scar.
Mm-hmm.
It wasn't like that at the beginning. It's been stirred up.
Mm-hmm.
It's all the crud that's been trapped here, and now he's abusing this as a result, but that's the...
How does the gua sha feel?
Doesn't feel bad. Feel worse on my chest, that's for sure.
Yeah, just like your left middle back is locked, this left hip is locked. This is a percentage of why the right lower back is injured. Yeah, I like when you rub my right hip. Feels good over here, Ed. That left hip, no thank you. See, this side already works. This side's already moving. See, there's no lump. Right there is where the blockage is. So you almost have to lie to your doctors. What brings you today? My left middle back feels tight and my left hip feels tight. Don't tell them about this. Because if you tell people about that, they can't help themselves. They want to work on it. It's like rubbing a cut on your skin. You're just ripping the cut open more. Leave the cut alone. Now you can really see it. You see it, baby? That is a gnarly scar. Something happened.
This is painful.
It is a little.
Sorry, bud.
It's all right. I can handle pain.
I could cope with torture.
I mean, you can, I'm just gonna, you can see it.
See how the skin looks like?
Mm-hmm.
It's all different. That's all feels like an old scar. Like it's about right like that.
Yeah, it looks different than the
Yes.
other one. Well, I broke my right toe.
Okay.
Yeah.
Easy, easy. This one, the big one?
Yeah.
How long ago?
Like a year ago.
Okay, all right.
Should be healed now, but
I'll take it easy on it. Otherwise, it'll be a title of my video. Dr. Ed broke my toe again. Okay. Okay. Okay, good. Okay. 1 second. Go ahead and tilt your head left for me. Tilt left. So you're just going to take your head and then sort of just tilt your
tilt
left.
the-
Yeah, it's okay. 1 second. Okay. Go ahead and tilt head left for me. Uh-huh. Go.
Same tilt.
Same thing, tilt left. Okay, good. Okay. Go ahead and tilt to the right now. Go ahead, tilt to the right, tilt right. Nothing else. Okay. Right over here in front. Have you ready? Yep. Move your feet left first. Move your feet left. Or yeah. So you just, there you go. What you you can pick up and move your feet to make it easier. So, there you go. Now you move knees right. Now knees right. Yep. Now you go knees right. This way. There you go. Now you go knees right. Does that make sense? Stretch the left side.
Yep.
Yeah. Now knees back up. Now move feet right. Now go knees left. There you go. Breathe. Yeah. This side's gonna be harder because you're compressing that left side now. And then knees back up. Stay in the middle for a little bit, and then put the feet back in the middle. Let's take a break.
Okay.
I could put it nicer. That knot in your middle back is atrocious. I am appalled that nobody has seen something so large. That is probably the largest injury I've seen in someone's middle back in a long time. It is a dramatic injury on your left middle back. Do you see how this is placed right over it?
Mm-hmm.
Right. This device emulates my elbow, and we use this now to stretch and put pressure and hold pressure on that spot. Now you might feel like you're crooked on it. Do you understand?
Yeah.
You might feel like you're lopsided because your left side is so much more elevated that it might feel like you're, falling off to the right side, when in fact your back needs to level out. And as you do this more, your back will level and get easier Do you have a foam roller? Have you ever tried laying on a foam roller?
I do have foam roller, yeah.
And have you done that on your back?
The one that you put like in your spine, pretty much.
Right.
Yeah,
Kind
yeah.
of starting from top. Well, this is obviously a lot different. The pressure is more pinpoint.
Yeah.
The roller's contact is more broad. This is what you're going to start with at home. To make this is a good size for you. To make it larger, you can put some books underneath it if you need to make it larger. But this is the size that I want you starting with.
Okay.
And you have to master 20 minutes, and it'd be a joke.
20 minutes?
Easier said than done. That it takes time to stretch your spine. Now, to get to 20 minutes, it's crucial that we try to stay on it for 20 minutes, in that if you can't handle it, you put something behind your head or you limit the depth so you can get 20 minutes first.
Okay.
20 minutes is a real number for how long it takes to change your posture. So if we don't get to 20 minutes, we're not going to see a lasting change. If you did 10-minute stretches, you're not going to see a permanent change. You got to get to 20 minutes. You see about between 15 and 20 minutes, a strong urge to get off this, and that's when the ligaments are finally lengthening and your posture is changing.
So it's way better now, but at the time I made the appointment, I
Yeah.
could not move to the right.
Turn your neck at all.
Yeah, and I see what you do for the people with the
Yeah.
massage, because the regular chiropractors, joint chiropractic and stuff, they only do the adjustments. They don't do the massage. So
And even-
I see the spots you're hitting, and that's exactly where.
It's
I'm
hard
feeling
to,
the pain.
as a patient, it might be hard to tell where they adjust to. The lower neck is so commonly the most injured area. And so if the joints, for instance, on this side are swollen, you won't be able to compress them, right? And so this part of the neck isn't where we should be utilizing very much anyway. We should be using our upper neck to do most of the work. But if the lower neck is doing all the work, so it's your backup engine doing the work, the
Right.
upper neck is your main engine, it doesn't work. So now you're not left with anybody to actually function with. And so you can't turn your neck at all without. Was it just going in the neck, or was it going down
It was going
into the shoulder?
It was going downwards into the shoulder too.
So when that happens, we're involving two things. You have the joint in the lower neck that's sprained, so the actual knuckle back here is injured, and then the wire coming out from the side will radiate pain over into the shoulder. So you have the nerve in the lower neck involved and the joint. So there's really two injuries, but it can be a disc injury, but the local pain is most likely the joint that was given. That's why you couldn't turn your neck. The joint is swollen, but usually if the joint's injured, most likely the disc is injured also. The care chiropractically should be focused on exclusively the areas around that aren't injured, that take the stress off the injured area.
Okay.
Maybe
And my wife tells me all of this is really hard.
Yeah.
It's really, really hard.
The muscles will get tight
Yeah, very, very tight.
to protect. Yeah.
Yeah.
So if you turn your neck to the right, go ahead and, any pain right now when you turn right?
Just a little bit.
A little bit on the right.
Yeah, on the right.
Okay, and then turn your head left for me. Uh-huh. Even that way is a little more restricted than the right. Okay. More straightforward. I gotcha. All right. Left shoulder's a little elevated, so that's avoidance of that right side. So when I'm looking at you, you're still in avoidance. So like when these joints get injured, your body will just sort of, heal tilted away from it. Now what'll end up happening is if you stay in this kind of alignment for too long, the other side will start to get injured because we're throwing the weight away from the right side and onto the left. Any
Yeah.
pain in your lower back, anything else?
Yes, prior to this, I had the tightness,
Okay.
the lumbar. I had that. It was really, really bad.
Right in the small of your back down
Yeah,
here?
it was more on the right side though.
Okay.
Yeah.
And if you tilt your body to the right or tilt left, does it hurt?
Right now, no.
Nothing. But you think in the past it has hurt
Just it's really bad. It was
just
tight.
moving around?
Yeah.
All right. And did it go down?
What triggered it most of the time is when I'm brushing and I
Right. Spinning?
yeah,
Uh-huh.
then I felt,
You felt
the tightness there.
Did anything go down the leg or it just stayed there?
So I was playing soccer with my kid and I fell and I had this numbness and tingling to the left side for a while,
Down all the way to the foot?
down all the way.
How long? And
Just
so
never felt the same.
how many years ago did that start, you think?
That's about a year ago.
Okay.
Yeah, but now it's mostly resolved, say like 90%.
So both of those injuries, when we have the local pain again is the joint, and then we have disc symptoms. So we have the discs starting to bulge out, and that's where we get an MRI, magnetic resonance imaging. X-ray won't show it, and this is where, if you take an X-ray, you might see the spaces looking good because the discs will actually swell before they rupture out. And so a lot of patients sometimes can be led down a wrong path because, oh, your x-ray looks good. It's like, well,
Right.
no, he's 40 years old, your x-ray is actually a swollen disc, and before it ruptures out completely, then maybe 55, the space is all narrowed. But you have to see an MRI to really,
Right, and
to
of
know
course
what's
the-
going on.
Yeah, they did an X-ray
And you're gonna
found
miss
nothing. Yeah.
Well, there you go. Another silly treatment protocol for a young person like this where you have, I mean, until you're 60, where then it's obvious the discs dry out and then you have the height loss. But at 40 years old, the discs are going to be swollen, they're more fleshy. And so we want to, if you're going to do any imaging, it should be only MRIs. X-rays would be silly for this. And so we want to, again, do two things. Loosen up the areas around. So you'll see me working on the joint below, the joints above. And then at the end of the visit, we're going to try to see how well we can do about bringing that curve back to your lumbar. Your back should have a sway in it. You understand? When we lose that curve, all the weight goes down to the lower back like a ladder. And then your middle back needs to be soft, right? If your middle back is real stiff, right? See, there's no bending happening where your hand is,
Right.
All the bending is happening at the bottom. And so we have essentially grind this area because this is all stiff. And if I bend with my middle back tight, you're gonna bend too much with your lower back. All right, bend both the knees for me. We're gonna move some stress away from that lower back. I'm gonna help you a little, sit up for me. Take a deep breath in. Try to let all the air out, exhale. Good, deep breath in, I got you, moving. Head back, let it go, I got you, relax your chest. Good, deep breath in, one more, exhale. Yeah, way too tight right there, okay, I got you. Let's go on your side, all the way on your side, I got you, breathe. Let's see if I can put this, there we go. Breathe for me. I'm not gonna fall, I promise. Take a deep breath. I'm not gonna fall off the table, I promise. Exhale, wow, really tight. Yeah, it's okay, there you go. There you go. Uh-huh, breathe, exhale. All right, other side for me. It's tight, we'll get it. I don't want you bending too much here. That's why when I'm adjusting you, my hand is up here and down here to try to not let you bend where you already been bending.
Okay.
Like a piece of paper, if you keep folding it back and forth, it starts to tear. We have to create a new point to bend in. It's like a tooth, you're always chewing on the same areas, and we have to unlock the parts that you're not chewing on. Breathe. I got you, it's okay. Exhale. Breathe. All right, good, very good, okay, very good. We're on your back for me. A little bit of right atlas, yeah. Okay. B.J. Palmer is the first chiropractor's son, and he spent the last 30 years of his life pretty much talking and writing exclusively about the importance and necessity of this upper neck in functioning to ensure that the lower neck doesn't get destroyed. And the understanding that the curves, the loss of cervical curve is what does it, wasn't completely understood until the 90s. 30, 40 years ago, they started to understand that our lives being inundated with looking down and loss of curve create the environment where the upper neck gets tight, the lower neck gets overstressed, to the point where almost all medical surgery exclusively happens right where you were pointing on that right side on the lower. When you overstress a joint, it will grow. In the same way, if you overwork your muscles, they grow, and if you overwork your skin, you get a callus. The muscles, joints, and skin get larger when we overstress them. When your muscles grow, no one calls it a disease, and no one calls a callus on your skin a disease, but if a joint grows, in America we call that degenerative joint disease. It's not a disease process for a joint to get bigger. It's the same thing as a muscle getting bigger, and if you call a joint getting bigger a disease, you have to call a muscle getting bigger a disease, or calluses on your skin diseases. Do you follow me? They're all adaptations to stress. Here we go. I got you. Doing good. There you go. Just this top guy a little bit. Very nice. There you go. All right? Okay. If you have to cry, go ahead. I'm just teasing. That was amazing. It was the best adjustment ever, Ed. So notice this side was a lot tighter. Do you remember when I adjusted your neck? The right side kind of stuck its tongue at me. The left side was like, oh, okay, sure. This knot right here is at the core of what happened.
Okay, so there's a knot right there?
Yes, sir. Yeah, right here is the problem. It represents a lack of mechanical participation and function. This area is restricted. They found very quickly when a joint doesn't move, it starts to become stiff. And just life and posture injuries, whatever, puts this in an environment where this joint got tight. It can happen as quickly as something like 10 days. Yeah, wow.
Trust me, it's soft.
Fine.
It used to be really, really hard.
I got a strong thumb, but jeez. That is,
I don't even feel what you're doing right
yeah,
now.
that is a boulder in there. All right, I'll get it with my elbow.
Like I've pretty much been to
I got you.
hundreds of massage places.
I got you. Oh.
I just don't feel a thing.
There it is. Go. All right, I'll come They're just knuckles. They're designed to bend. I'm not asking them to do something outside of what they're mechanically supposed to be able to do. Right? It's not like I'm asking you to spin your head around. I'm just asking these joints to function in a normal capacity. They're underworking. This joint is way too tight up here. And so for every underworking joint, there has to be an overworking joint that compensates. Wow, he's powerful.
I have a very high pain tolerance.
Perfect. There, a little movement there.
Fall asleep on you.
Go ahead. You can do that. I'm not working hard enough. If you want the core injury, it's right there. That's
I feel it.
Yes, sir.
Are you feeling it for real?
Mhm.
Like, is it deep enough? You want to-
I feel it. I feel it. I have literally begged my friends and family to do what you just did, but everybody runs away.
And I ran so far away. Good old flock of seagulls. I just ran. I think it's in the Batman vs. Superman movie when the building's crashing down. You see that movie? And Bruce Wayne is running towards the building that's falling, right? Everybody else is running away, right? And Bruce Wayne is like running towards the building. That's... I'm running towards this knot. Yeah, get it. There we go. It's getting smaller. It's,
Yeah, like it's I
Yeah.
don't feel it.
Yeah. It's getting there. You gotta stop feeding it. You're tilting your head left way too much. That's what's feeding it. So if you put your bag or backpack, you gotta stop putting it on your left shoulder. If you put that on your left shoulder, do you see how you hike the shoulder? And that tilts you away from this. So you want to put that actually on your right shoulder, or not have it. You shouldn't have any shoulder. My point is that if you're going to have it on something, it would only be, does that make sense, on your right side, so that it actually would close this side and not tilt your head away from it. Yeah, that's good. There we go. Perfect. Let me see that. Let's see if we can adjust it. Let's try to open this up a little bit. There we go. All right. I got you, but relax your shoulder down. I got you. Now relax your head. I'm waiting. You're fine. There we go. I'm waiting. Let this side go. There it is. Yeah. That bone has not moved in a while. When my butt comes off the chair, I'm working way too hard. Do you see how much higher this is here? How much tighter? From here to here is a huge knot. This is much lower. Nice and soft. This is why it went down the right leg. Do you see? The right. This is why you sprain this side, because this is tight here, and you sprain the right lower. But the reason why you're spraining the right lower is because you have an injury on this left side That's probably why you had it down the left leg, and then you're now avoiding the left side, and now we're abusing the right side in what we call compensation. But the oldest injury is right there. My dad has taught me since a teenager to target the stiffest area, right? Because if you can unlock the stiffest area, you give the most relief to the abused area. And your stiffest part, and I hope when you get back home, if people can't see this thing right here, we're in trouble. It is painfully obvious that this is the tightest part of your back, right there.
Yeah, I feel it.
That knot, probably been here since you were a teenager or younger. That's your problem. Okay. All right, I'm gonna get you feeling something here. Yeah, that is way too tight. Right there, it's painfully obvious. They gotta be able to find that.
This is new to me.
Yeah, I
So I
understand.
always got the issue with the neck.
Yes, sir. Well, the neck creates this, or at the very least puts this in a position where it's more easily injured. And so, yes, the neck is the ultimate problem, and then it creates domino problems, but that doesn't take away from the fact that this is the most direct cause of your lower back symptom. Indirectly, yes, the forward head posture, the knot on the right upper part of your neck creates this, but this needs to be untangled. B.J. Palmer would have taught just work on this, and this would go away. And I'm not completely disagreeing with him, but I believe that to expedite this and to get this done in a much faster way, you need to work on this knot. You'll hear it, upper cervical chiropractors, where they're going to be kind of solely focused on the atlas, and I get what they're getting at, but we can't ignore the rest of the spine. I mean, yeah, wow. Come on. The only thing I can say is don't ask for more, okay? Because I'm just going to give you everything. And if you ask more, I go, that's all I got, but I gave you all.
I think I feel it easing up though.
Yes, yes.
Oh, good. That's good.
No, I will come back to it, but do you bring it?
So you're feeling this massage, right?
I mean, yeah, a lot smoother over here.
Is that a knot?
Yeah, these are the roots of your neck, but it's also part of that injury on the left side.
Yeah, I feel it.
think somebody wants you, Carl.
Split there, babe.
Okay. Yeah.
Oh, never have guessed.
Yeah, nobody showed you that scar right there.
No, not ever.
Everywhere else nice and smooth, and right there, very big scar. I mean, what a difference. I mean, you can see it just feel soft here, right? Soft. And that lump here on this left side. Yeah, you got to put a back brace on. When you're doing any type of lifting of a patient, you gotta have a back brace, and you just put it on like a Velcro brace over your lower back to bind up and protect your lower back when you're lifting patients. You can't be doing that without some sort of back support. And then you unvelcro it once you're done lifting. But when you're doing any type of lifting type bending forward and lifting maneuver, it's gonna catch up to you.
Yeah, I did a lot of heavy lifting.
Right. So this is the joint below. This is what I adjusted when you were on your side.
Mm-hmm.
This joint ends up quitting when we sit for too much, and that again puts all the stress on your lower back, lumbar 4 and 5. So keeping this joint in the team, on the team is imperative. jackhammer, chiseling away.
Feels great.
That cool.
Feels really good.
Did you feel the massage?
Yes, I did. I did. I did.
Just wanted to work this guy a little better. Use gravity to my favor here and work this. Right there, yeah. It's softening up pretty good. Yeah, time to move to Florida. Time to move to Florida. There's no bottle of Dr. Ed I can give you. Yeah, that's the problem. Ed, get out here and work on my shoulder. Work on my neck. Good, thanks. Okay. Go ahead and tilt your head left for me. Tilt left. Go.
Ooh.
Go ahead and tilt left.
Never had that one before.
All right. Go ahead and tilt right. Up, okay. Okay, tilt to the right. Nothing on that side, okay. And then it's like 20 minutes. Your neck needs to bend over this, so we have to first unlock your spine to make this, possible and to make it effective. What happens is if you put people on this and their neck is stiff, it doesn't do
work.
anything.
Okay.
It doesn't work. So this has to be used in conjunction with care.
Okay.
Yeah, your neck, all the bending wants to happen in your lower neck, and I'm asking your upper neck to bend, and it's, really resistant in the upper neck. And 20 minutes, this keeps your upper neck functioning for longer, right? It's like a retainer that an orthodontist gives to keep your teeth from going back to crooked. So with chiropractic care, we use this to restore the curves in your neck and then to maintain them. And then
This has to be done on the floor, yes.
Correct.
Not in bed, right?
in bed, you'd be
Too soft,
easier.
too cushiony.
You could, but it's just less benefit. Ultimately, we need to be able to do this 20 minutes on the floor and it'd be easy.
Okay.
And then to get off, you roll to your side. So roll to your side. There you go, roll all the way to your side. Use your right hand behind you to move it out of the way. If you can push it out of the way, push that out of the way. There you go, and then lay back on your back. That make sense?
Okay.
That's how you get off that. And then after you do that for 20 minutes, give yourself a few minutes before you get up. Let your body reacclimate, adjust,
Okay.
to show off a little bit.
It feels
Yeah.
decompressed.
Oh, it's gonna change your life.
Yeah.
This
it
is-
does. It really does.
This is my portable thumb. So you asked me, this is called the Deneral pillow. You can purchase these online. You don't have to be a doctor to buy these. Like this device you can't buy online, but this you can go on the website and buy a Deneral pillow.
Okay.
We need to be on our back sleeping. If we're not sleeping on our back, it's because many times there's monsters in our back that we go to our side to get away from. So my instruction is let's get the spine clean so you don't feel the desire to run away from the problems in our back. This is the Deneral pillow. It has a mini version of the neck guy in the pillow. And then there's a little hole here that you can open up and then head back and let your head sort of sink into that hole, and you can stretch on the pillow. If you want to stretch a little bit, you open up that little flap and then you can stretch, and then if you want to go to sleep and not stretch so deeply, you kind of just lift the flap up, and then it reduces the depth. All right, you doing good?
Really good.
Nice and
really,
loose.
really good.
All right, thanks for getting here.
Thank you so much.
Awesome, you
It's
did
been
great. Awesome, appreciate it, thank you.
Well worth it.